Trying to do videos when I'm running out of power. Ooh, the excitement. The danger. Yawn. So anyway, I'm going to give you the point here. Black widow spiders, hobo spiders, and brown recluse are dangerous spiders. Necrosis of tissue is caused by two of them, the hobo spider and the brown recluse. Causes the tissue to be destroyed. You can read below in the description what happens, but the Wikipedia article on the hobo spider is being sat on by a Wikipedia bureaucratic fork in the road who clearly particularly likes this type of spider, so said everybody there. And this is what's said on the article, which is not true. They're native to Europe, but the distribution map only shows them inhabiting the Pacific Northwest. They're related to one in Europe. They're not from Europe. Consensus is the hobo spider is not dangerously venomous species. That's not the effect. What happens is the venom causes the tissues in the cells to stop working correctly. It's not the venom, it's the effect it has. And it causes a lot of damage. They have long been debated about the subject of the toxicity and aggression. No, it hasn't. They're not particularly aggressive, but the venom is able to do this, and it's not the toxicity, it's the damage that happens from the infections that opportunistically attack. They don't bite unless forced to protect themselves. Now we're seeing part of the fanboyism. Yes, spider truthers. So anyway, the CDC no longer considers it a dangerous venomous species. It never did. Why are you phrasing it that way? The CDC and government agency claim the hobo spider bite causes necrosis in humans. Yes, it still does, but you said it wasn't dangerous. Why are you building this way? Despite the absence of any confirmed cases, I'm one of the 20 in the city of Portland, Oregon. Don't tell me I'm not a confirmed case. There's even a question as to whether the lesions observed in the original study of rabbits were necrotic. No, they're not. That's simply something you observe. It is not questionable. Subsequent attempts to replicate the study injecting sufficient venom to ensure this have failed to produce necrotic lesions. That's not true, and it's not in the citation given. And everyone's telling you to stop fanboying. I'm going to start editing the page. This is your only warning. Run. Run. So anyway, next. Someone didn't seek medical attention. Began to bleed from every opening. Admitted to the hospital with diagnosis of aplastic anemia. Pansepticemia, I can't pronounce it, and such. A mass on her leg was consistent with necrosis from a spider bite. Despite transfusion therapy, the patient developed severe internal hemorrhaging and died a few months later. The bite of a hobo spider is usually almost no pain. Creates a dent. I'm going to use normal words here within 30 minutes. Surrounded by an area of expanding and inflammation, and can attain a diameter of up to 5 inches across. Blisters develop within 15 to 35 hours. The blisters can rupture with serious encrusting and a cratered wound. This is called a carbuncle. A scar mass can develop, underlying necrosis and eventual sloughing affected tissue. A chunk of your face falls off. Lesions generally heal within 45 days, but they can result in permanent scarring and or require 3 years for the bite, if the bite occurred in fatty tissues, to heal up. Or in my case, almost losing both legs, having part of my spinal column having to be operated on, part of my chest, both eye sockets, and my nose from recurring infections that got in from the original bite. One of my friends lost part of his calf. We're part of that list of people you said were not really confirmed cases. The individual making an attempt to doing this, Dyanega, burn in hell. Next, the most common systemic symptoms are severe headache within 30 minutes after the bite, usually within 10 hours at maximum. Persist for a week. Other symptoms can include nausea, weakness, fatigue, temporary memory loss, and vision impairment. Yeah, I went blind. Protracted systemic effects including aplastic anemia, intractable vomiting, projectile vomiting, profuse explosive diarrhea, and are rare but may be associated with death. Medical references should be updated to acknowledge the causes of necrotic arachnitism. It also can cause convulsions because someone else in the building that got bit, like me and the other person, he went into convulsions and his head was bashed in because he started going into convulsions on the part of the floor that had cement. He beat his head in from a convulsion. To the idiot editing on the Wikipedia, go to hell. Thanks for watching. Have a good day. Good luck with that.